any doctor like myself who treats athletes is going to see a lot of runners. Runners notoriously get injured at one point in their career or another. The most common injuries that we see in runners is related to the knee. So the most common injury that you see in the knee is runner's knee or jumper's knee, which is an injury to the patellar ligament or patellar tendon. So that injury responds really good to prolotherapy, but runners can get any kind of injury around the knee, especially the meniscus. So if a runner has swelling, most likely the swelling is because they injured their meniscus. Meniscus injuries, whether it's meniscus degeneration or meniscus tear, responds great to prolotherapy. Ligament injuries, anterior cruciate ligament injuries, chondromalacia patella, where the cartilage is deteriorated, responds great to prolotherapy. Often when runners have knee pain, the patella isn't tracking correctly. So the patella is supposed to track in this groove here in the femur. So when the patella is out to the side and it tracks poorly, that's called patellofemoral tracking syndrome or patellofemoral pain syndrome. And then when it causes cartilage deterioration, that's called chondromalacia patella. Just as a side note, if anyone who's had knee surgery, anyone who's had knee arthroscopy, look on your arthroscopy report. You'll be shocked to see that it says chondromalacia patella. 90+% of arthroscopy reports that I've seen, the doctor saw that your cartilage is getting deteriorated. I believe the best treatment for cartilage deterioration is prolotherapy. I'm confident that long-term studies and x-rays and MRIs and all that's going to show that the best treatment to regenerate cartilage in an athlete is prolotherapy. So anyone with chondromalacia patella should get prolotherapy. It's very common for runners to call us, or athletes that are involved in running sports, because they have a foot problem. The most common foot problem that we see is either ligament injury around the ankle, because that's the most common ligament injury when you sprain your ankle. And often ligament injuries don't heal. About half of ankle sprains, give or take 10%, don't actually heal completely. You might get pain-free, but now all of a sudden you've got excessive joint mobility. That excessive joint mobility makes it more likely, for you to get an ankle sprain in the future. So, if the ligament healed completely, it wouldn't have an increased rate of getting a second ankle sprain. So why sports injuries often occur again and again on athletes is because the tissue wasn't completely healed. Why wasn't the tissue completely healed? Because the athlete did ice, compression, elevation, anti-inflammatories. That's a big one. Your ankle's hurting, so you wanna run tomorrow, so you take an anti-inflammatory. You'd be amazed how often we hear of athletes who, before they play tennis or whatever, because their body hurts, they take an anti-inflammatory. I mean, your body's hurting for a reason. Your body's hurting because some tissue is injured. So the treatment should be, you as an athlete, you know this, get the tissue healed. Like if you continue to play athletics on an injured joint, even if you can't feel it because you're taking an anti-inflammatory, it's going to lead to further injury, further treatments, more invasive treatments. And is a joint replacement really what you want as an athlete? Another common injury that we see in runners is plantar fasciitis. But let me say one thing from the get-go. Most cases of plantar fasciitis, it's not plantar fasciitis. In other words, it's not an inflamed plantar fascia. You could touch the plantar fascia. It's not hot. It's not inflamed. It's a degenerated plantar fascia. So right from the get-go, it's not plantar fasciitis, so it doesn't make any sense to be injecting steroid in there, which just is going to further degenerate the plantar fascia. What a degenerated plantar fascia needs is prolotherapy. Prolotherapy stimulates the regeneration of the degenerated plantar fascia. So generally after 1, 2, 3, 4 visits, the runner's back to running. The good thing as it relates to sports and prolotherapy is prolotherapy doesn't interfere in the training of the athlete. You can still train while you get prolotherapy. A common injury that we see in runners is, especially runners with foot problems, is pain in the heel. And most of the time, they've had the boot, they did various stretches, their plantar fascia still hurts a lot. Unfortunately, many of them come having already received a cortisone shot, and cortisone shots just degenerate the plantar fascia further. If an athlete's had pain more than a few months in a body part, I'm telling you, it's a degenerated structure. So a degenerated structure needs regeneration. The treatment by injection of regenerating a structure is called prolotherapy. Prolotherapy involves the proliferation of cells. So if, say this is the heel and you have the plantar fascia that attaches to it, what that degenerated plantar fascia needs is prolotherapy. You need it regenerated. Now when the plantar fascia, the degenerated plantar fascia continues over time, the body, to strengthen that attachment where the plantar fascia attaches, will overgrow a bone. So the overgrowth of bone on the plantar fascia is what's known as a bone spur. I got a bone spur on my heel. Can prolotherapy help? Well, yes, prolotherapy can help, because the body's trying to prolotherapy itself, but it's not doing it. You're still having pain. So we would just, speed the process along. So an athlete should think about prolotherapy as, hyperdrive, like hyperdriving the injury to heal quicker. So you want the injury healed quickly? Well, then get prolotherapy. Prolotherapy can stimulate the healing many, many times. Also, what athletes don't realize is often when you get a degenerated plantar fascia, the ligament support of the arch is also a problem. So prolotherapy also can help that ligament support of the arch. There's a very important ligament that supports the foot on the bottom of the foot, and that's called the spring ligament. So when I see someone with plantar fascia problems or foot problems, one of the structures that I'll evaluate is the spring ligament, and often they need to get prolotherapy in their spring ligament, which will help repair that area, and then the arch support is much greater. And once they get the degenerated plantar fascia repaired with prolotherapy, then their foot pain's gone and they're back to running.